Good to see you as always. We begin with the report, if you heard about this, that shocking medical announcement from veteran news anchor Tom Brokaw. Mr. Brokaw revealed that he's been diagnosed with multiple myeloma, an incurable cancer affecting blood cells in the bone marrow. So, Dr. Sutmati, what is it? How do you detect it? And what's the prognosis?
Eric, multiple myeloma is a very rare cancer. About 1% of our cancers are multiple myeloma. 20,000 people are diagnosed every year, and unfortunately, 10,000 people die from this. You know, it starts from bone marrow, and a lot of people don't know what bone marrow is. It's a soft part in the middle of the bone, and I think the simple way to understand it, think of it as a Federal Reserve Bank. In the bank, you have a lot of different currencies. You have dollar, you have yen, you have euro, and when you start printing out a lot of dollar, what happens? The value of the other ones, other currencies go down. That's exactly what happens in the bone marrow. You start producing a lot of plasma cells. So in a way, multiple myeloma is the cancer of plasma cells. These are cells that are supposed to make these soldiers to defend us, but they're going out of sync, and now you have a lot of plasma cells or a lot of dollar being printed out there. Now the value of the red cells and the platelets, it goes down. So you don't make enough red cells. What happens? You get anemia. If you don't have enough red cells, you get fatigue, you get tired. Now you also have some lytic lesions, meaning that the bone is going to be eaten up, and you have in the skull, in the ribs, so severe bone pain. So now you have fatigue, not enough red cells, you have bone pain, your calcium goes up, and the mnemonic for multiple myeloma is very funny. It's CRAB. C stands for hypocalcemia, or too much calcium, Jamie. R is for renal failure. So your kidney function goes down because all these proteins affect your kidneys. A is for anemia and B is for bone pain. If you have that, then you want to worry about multiple myeloma. We're making some progress. I'm going to let Mark talk about some of the diagnostic
what's the prognosis
tools.
And how long can you live with this and what happens?
I want to add one thing to David's excellent explanation, which is the proteins that those plasma cells make are atypical and they're heavy. It's supposed to be antibodies that the plasma cells make. It's supposed to be our immune system. Instead, it makes these heavy, clunky proteins and antibodies that don't work, so they clog the kidneys and they make you anemic. And then, as David said, they spread to the bones. You get bone problems. But what do we do? Eric, here's what we do. When I first started in practice, this was one of the worst cancers you could get. You were dead within 2 years, and everyone said, you know, brain cancer, multiple myeloma, and pancreatic cancer. This is one of our success stories because of certain treatments. We are now able to keep people going at least 7 or 8 years, oftentimes over a decade, and I hope that's true with Tom Brokaw. Here's why. Because we used to just use poison to poison the bone marrow, chemotherapy, wipe it out, and hope it recovers. Now, what we do instead is we use a drug called thalidomide, which was originally used, you might remember, pregnant women were given this in the late 50s and early 60s if they got very nauseous during pregnancy, and we found that it caused birth defects. So we threw that drug out. Isn't it amazing, Jamie, that now we've come back to a drug we discarded, and it's having great uses in multiple myeloma because it cuts down blood flow to these plasma cells? In addition, we use bone marrow transplant now, and we use stem cell transplant now, where we after we wipe out the bone marrow, we're able to replace it with a person's own cells that have been cleansed of the cancer cells. So it's made a dramatic change in this disease. It's no longer the uniform killer that I thought
and
of.
how do they detect it? Well, how do you know you have that versus another type of cancer?
What you would do is you would get the urine protein electrophoresis, meaning that you get your urine and you get your blood.
So a urine
and you
test?
Urine test, and you get your blood test, your serum, and you would basically look for that spike of some of these proteins that Mark is talking about. The reason why I jumped in, I want to make sure that people know about this International Myeloma Foundation, and you can call 1-800-452-2873, and I'll post this on my Facebook, 1-800-452-2873. This is a foundation that really reaches out to a lot of people. There's a lot of support out there, and as Mark mentioned, the prognosis is still not so great, but we've made a huge leap in some of these bone marrow transplants, especially autologous, your own cells, to make sure that you do well.
One last point on Eric, on your diagnostic question. Abnormal proteins, you look for that in the blood, then you have to confirm it by going into the bone marrow itself and finding the malignant cells. That bone marrow, biopsy, right? That bone marrow being the engine that's making your blood cells.
All right, well, certainly our thoughts and wishes are with Tom Brokaw and his family.
Yes, word is that he is doing well, and it's great to hear a good news story that we've made some progress in that field of cancer.